I'm Kelly Carlstein from Blake Medical Center, and this is Healthy Living, a show that brings you the information you need to live a healthier, happier life. On today's episode, we'll be talking about microvascular surgery. I'm very happy to have two special guests today, microvascular surgeons Dr. Leong and Dr. Senchenkov at Blake Medical Center. Thank you both for joining us today.
Thank you for having us.
Dr. Senchenkov, let's start with you. Can you tell us a bit about yourself?
Well, I came here from Soviet Union when I was already trained physician and completed all the training requirements in the United States and residency and fellowship in surgery, plastic surgery, microsurgery, and head and neck, surgical oncology. And I joined Blake Medical Center in a group with Dr. Van Vliet and Dr. Leong, which has been a true privilege.
And Dr. Leong, what about you?
Well, I'm a Californian by I guess I was raised there, but pretty much I'm a transplant to Florida. My wife and I moved here recently. We really like it here. I was trained mostly in California, but I did my hand surgery I am a microsurgeon, hand surgeon, did my plastic surgery at the University of Texas, did my medical school in California at UCLA, and then I did my hand fellowship again at University of Southern California, not South Carolina. Mm-hmm. And I used to be I used to teach at Dartmouth, and that's how I met Dr. Van Vliet. And what I've been doing, my emphasis has always been to do sewing small fine vessels, working on fine things. It kind of dovetailed into microsurgery, dovetailed into the plastic surgery because I'm very meticulous. Some people say I'm very, I'm a perfectionist. I like to have things exactly the way I like it. And I think that plastic surgery just fit my personality, and that's why I do what I do. I like what I do. I really enjoy what I do. And I think I try to make it fun every day, and I think that's, otherwise it's becomes medicine is a very, a field where sometimes you just have to inject a little bit of levity and enjoyment into it. Otherwise, it becomes tedious and monotonous after a while.
Yeah. Dr. Senchenkov, can you tell us what microvascular surgery is?
As Dr. Leong pointed out, it's about sewing small vessels to achieve certain goals. And there are multiple goals that we can achieve that involves in preservation of fingers and reconstructing tissue defects where there is no tissue available, such that we can take tissue from one area where there's a known and predictable blood supply and reconnect those small vessels to permit this tissue to live in the area where the tissue is needed. And that is called microvascular flap or a free flap. And those are the main applications of microvascular surgery.
And it sounds like that you would need a lot of training and education to become a microvascular surgeon. Is that correct?
There are certain requirements. Usually microsurgeons are trained in plastic surgery, but there are microsurgeons amongst orthopedics and head and neck surgeons. But majority of microsurgeons are plastic surgeons with additional training and expertise. It usually requires a fellowship, which is a 1 year long after completion of plastic surgery training.
And what brought you both to Blake Medical Center?
We joined a progressive group at Burn and Reconstructive Centers of America. I was a partner of Dr. Van Vliet at University of Tennessee, and we had good working relationship, and I thought it's going to be a very good fit, and I think it is.
And you, Dr. Leong?
Well, I think our common thread seems to be Dr. Van Vliet, but I think there was a need for what we do here in this community that I don't think anybody else in the area offers the kind of advanced plastic surgery that we as a group can offer, and Dr. Van Vliet and I spoke at length before I moved here, and we felt that this would be a great area to fill because there's such a big need for us to really provide the care that our patients need in this community.
And how do you think that this benefits our community, Dr. Senchenkov?
It benefits in several areas. One of the areas is breast reconstruction, of course, because microvascular breast reconstruction offers additional advantage of creation of the breast with the patient's own tissue. And the own tissue is usually taken from the abdominal donor site in the manner which is very similar to a tummy tuck procedure that provides an additional enhancement of the donor site and creation of the breast, which is the patient's own. That really an improved technique compared to the other methods of breast reconstruction, which are based on the silicone implants or transfer of the tissue from the back and other areas where donor site morbidity is more pronounced. And that's usually a bulk of microvascular practice. We have additional services that we offer in the treatment of cancer patients with head and neck cancer, cancers of other locations where there are critical defects, and reconstruction of the injuries to the hand and replantation of the digits, and limb salvage operations that we do for patients with trauma, open fractures, peripheral vascular disease, diabetic feet, and so forth. So microsurgery allows to solve the reconstructive problems that could not otherwise be solved without a significant functional detriment to the patient.
Great. We're going to take a short break and then we'll be back with more on microvascular surgery.
We are Blake Medical Center.
We are leaders in surgical care.
We are trained in minimally invasive techniques, such as Da Vinci robotic surgery.
We are committed to giving you personalized options.
Because to us, it's all about you.
Your health.
Your well-being.
Your quality of life.
Blake Medical Center. Exceptional care for everyone.
My name is Spencer Faust, and I currently go to SCF for college. I was a junior in high school when I got in the car with one of my friends, and we were driving home from a friend's house, and we lost control, hit a tree.
I got a phone call in 2013 from Blake Trauma Center that my son Spencer was in a major car accident. He was the passenger in the car, and he wasn't supposed to make it. And he had several shattered bones.
Well, this arm completely shattered, so they had to go in right here and basically put the bones back together, go in through the top and put a titanium rod in there and finish it off with a screw right here and 2 screws over here, hold it in place, and 14 screws right over here. Big titanium plate too. I have broke 2 ribs, punctured both my lungs, punctured a kidney and a liver, my sternum, and broke this right shoulder blade, broke my pelvis in 5 places.
Well, Blake Trauma Center is the one that even found out who my son was. There was no ID or anything. All that was wrapped up in the car. They couldn't even retrieve it, so it took 2 days to find out who he even was. And then I got a call from Blake Trauma Center.
I wasn't supposed to originally make it, so Blake Medical Center called my family. That I have family in Connecticut, Germany, Ohio, and everything. They just all flew down here to say their goodbyes. But Blake did a good job. I'm here, so I'm back to my full potential that I was. There's nothing that I can't do. So I can play my guitar just like I used to, still kayak and canoe. I can do anything I want, 100%, 110% actually.
The trauma center at Blake Medical Center was phenomenal. That's the whole reason why my son is here today. They were hands-on, did everything they could to give me my son.
are Blake Medical Center.
We are leaders in cardiovascular care.
We are trained in advanced technology,
like the minimally invasive TAVR procedure.
We are committed to giving you the best care.
Because to us, it's about you.
Your health.
Your well-being.
Your quality of life.
Blake Medical Center. Exceptional care for everyone.
Welcome back to Healthy Living. I'm Kelly Carlstein, and I'm joined by Dr. Leong and Dr. Senchenkov. What areas of the body are most likely to need microvascular surgery?
Well, I think there's almost any area could potentially need microvascular surgery. The goal of microvascular surgery is really to replace like tissue with like tissue. So if we're talking about breasts, say, we take tissue from the abdomen where there's usually an abundance of fatty tissue and transplant it up into the chest to reconstruct the breast. If we're talking about, say, the hand, occasionally, if we're not talking about trauma where we're putting fingers back together, where potentially we could make somebody a new thumb by taking a toe. So that's another potential. If we're talking about legs or lower extremity, a lot of times people have major accidents where they're missing a lot of skin, soft tissue, muscle, tendons, nerves, and there's bones exposed. You want to replace that. And sometimes the best tissue from that, for replacing that, is far away, and we have to take tissue and transplant it down there. The way I look at microvascular surgery and kind of the way I talk to my patients about it is that microvascular surgery is like a transplant from yourself. It's not really a transplant in the sense that there's no immune suppression involved, there's none of that stuff. But we are taking tissue from yourself, taking a blood vessel with that piece of tissue, and then hooking it up somewhere else, wherever we need it. And it's like spare parts. You take it from a place where you might be able to spare something and take it and put it where you need it. So that's that in a nutshell, that's probably the best analogy I have for microsurgery.
Can you tell us a bit about head and neck microsurgery?
Head and neck is a difficult area of the body to reconstruct missing tissue, because there is such a constellation of different functions and such a high demand for cosmetic outcome that bringing tissue from somewhere else becomes critical. There is a paucity of local tissues in the head and neck that precludes effective reconstruction of large defects that usually result of tumors, trauma, or burns. Those are the most common reasons in that order that require microvascular interventions. So by transferring the tissue from distant areas, we first allow us to solve the tissue deficit that exists following the resection. It enhances the function that has been compromised by the removal of the important structures. And last but not least, it optimizes the healing of that site. Since the majority of head and neck cancer patients have to be in radiation therapy within 6 weeks, microsurgery allows rapid recovery of these patients and timely continuation of oncologic treatments. This is why microsurgical reconstruction of large head and neck defects became a gold standard. And even in the presence of local options, most would choose microsurgery if there is a time limit on when radiation needs to be started. This is why microsurgery plays a key role in management of the patients with head and neck tumors and many trauma patients and burn patients alike.
And what about microsurgery when it comes to breast patients? When would that be an option?
Well, first we need to know that the tumor process has been controlled oncologically. And we usually rely on breast surgeons or general surgeons as colleagues to manage that aspect of the patient care. And once we understand that the tumor has been controlled and we don't anticipate chest wall radiation, at that point this patient becomes a candidate for microvascular breast reconstruction.
And what are microvascular breast reconstruction surgeries like?
Well, there are several donor sites that could be used to create a breast. Unfortunately, the microsurgical donor sites, other than the abdomen, often don't yield enough breast tissue to create a sizable breast. So it is important to be able to use the abdominal tissue wisely and effectively in the creation of the breast. Other sites that are amenable to harvest would be inner thigh, which is the flap that is based on the gracilis muscle. Buttocks, we can create perforator flaps based on upper and lower gluteal vessels. The profunda system has been used for creation of the breast, but unfortunately it's hard to take a large block of tissue without leaving a significant donor site defect or deformity. The only area where donor site actually improves from the harvest is the abdomen, because it is a tummy tuck operation with some minor differences. But everything else comes at the price. And this is where the role of breast microsurgery is. We create the breast from the patient's own tissue, and that tissue does not contract. It requires a lot fewer revisional procedures than the implant-based reconstructions would normally require. And that's actually one of the better reconstructive techniques. You can have a different car, you can have a Chevy, or you can have a Cadillac. So microvascular breast reconstruction is a Cadillac of the breast reconstruction. They're all cars, they're all reconstructions, but some of them are better than others. It has to fit, obviously, the patient's lifestyle. The donor sites have to be available. The patient has to be healthy in order to undergo such procedure. And the patient has to be motivated, and they need to be involved in the treatment process and care about the results. And suitable patients could have this reconstruction in vast majority of the cases.
Dr. Leong, can you tell us about microsurgery of the hand?
Mainly that the microsurgery of the, a lot of what we do as far as microsurgery of the hand involves saving people's fingers with replantations and things like that, where people have traumatically amputated their fingers, and we try to salvage that. We put the blood vessels back together, put the nerves back together, and we're able to put the finger back on. And that's something that we see fairly routinely here. But the other thing that we can do is in the hand is we can also take toes and make fingers. We can also take soft tissue from somewhere else to cover tissue deficits in the hand itself as well, to salvage the hand, that whether that involves trauma, tumors, or infections. I think there's a big role for microsurgery in the hand. So I think that what I've seen since I've been here at Blake is that there's a lot of people that have traumatic hand injuries that end up that don't know that there's this option available for them, and we've been able to provide that for a huge number of people here. And I do actually have a little disagreement with Dr. Senchenkov about the breast stuff, unfortunately. He doesn't. I think that microvascular surgery for the breast, I don't think that just because you're going to have radiation precludes you from having the reconstruction. I think there's a difference in opinion with regards to that. I think we have to approach that with a little bit of a, you have to have a discussion with the patient about that, and you have to be aware that that could be a potential issue. But I think that microvascular surgery for breast reconstruction is, you can do it on a lot of people, almost everybody, as long as they're a candidate.
Great. We're going to take one last break, and then we'll be back with more on microvascular surgery.
We are Blake Medical Center.
We are leaders in orthopedic care.
We are experts in procedures like hip and knee replacement surgery.
We have been recognized for our clinical excellence.
We are committed to giving you the best care.
Because to us, it's all about you.
Your health. Your well-being.
Your quality of life.
Blake Medical Center. Exceptional care for everyone.
And yet, I'm still here.
I shouldn't be alive, but I am.
It wasn't my time. I wasn't supposed to survive, but I did because of the Blake Medical Trauma Center.
Welcome back to Healthy Living. I'm Kelly Karlstein, and I'm joined once again by Dr. Leong and Dr. Senchenkov. Dr. Senchenkov, can you tell us about the microvascular and reconstructive program here at Blake Medical Center?
Well, here at Blake Medical Center, we offer full spectrum of microvascular reconstructive surgery. All of the areas that have been mentioned in the previous discussion, and all the services are available at the Blake Medical Center. We have a good team of partners, nursing staff, operating room, that allow to conduct these operations efficiently and safely.
Leong?
Well, I think that it's a unique program. I don't think that, I think we're the only program in the area that offers this service. I don't think that there's a lot of other programs quite like this that offers the degree of microvascular expertise outside of a major academic institution. Mm-hmm. I think that we've been able to build our breast program where we've offered bilateral breast reconstructions with autologous tissue from the abdomen, and where we've done free deep flaps up to from the abdomen to the chest, and these are for breast patients who've had breast cancer resections, and we've been able to restore their lives, and they are back doing their stuff within a couple of weeks after the surgery, and as Dr. Senchenkov alluded to, this decreases the number of secondary operations and revisions, and some people just aren't a candidate for implants, or don't want implants, or it just doesn't, and don't want to deal with having to have the risk of the implant rupture and then having to have that replaced. So the breast program at Blake has been growing since we've been here. We've also been able to offer breast hand surgery transfers, taking a toe, like I alluded to previously, making a new thumb, or a toe and making a finger, and then obviously people who otherwise would have lost their legs or arms because of trauma, because they've had a major car accident and they have they have bone exposed or hardware exposed, and the option that used to be amputation, but now we're able to save those, and people are able to walk again.
What's the one thing that you would like everybody to know about the program?
I think that we can offer quality of care, and that would be a very dedicated and individualized care. We can't give you 100% guarantee that all the results will be perfect, because no one can, but we can certainly give 100% guarantee that we will do our very best to help you in your recovery.
And Dr. Leong, what about you?
I think I tend to echo Dr. Senchenkov. I think that we as physicians and as a team are dedicated to our patients. We really do. We care about our patients. We do our utmost to ensure they get the best care they could possibly get.
And what's the most rewarding part about being a microvascular surgeon?
Is seeing patients in the clinic, is see the differences that we've made in these patients' lives. It is very, very rewarding. And these operations are long and they are tedious, but it's sort of like climbing the mountain. It may be difficult when you climb, but when you reach the top of the mountain and you look down and you see the positive results that you've accomplished with this operation, it certainly makes it worthwhile.
And Dr. Leong, what about you?
I would have to echo Dr. Senchenkov's statements because I think what we strive as physicians is to make our patients happy, okay? And the ultimate satisfaction that we get is when our patients thank us at the end of the day that they've been able to return to whatever they were doing before, and you don't know how many people we see every day in the clinic that just say, we're so glad that you helped us out and that you were able to get back to do what we're doing.
Well, thank you both so much for joining us today.
Thank you very much.
Thank you.
That's all the time we have for today. If you would like more information on today's guests, please visit us at blakemedicalcenter.com and click on the Healthy Living Talk Show. While you're there, you can also send me your comments or suggest a topic for one of our upcoming shows. I'd love to hear from you. I'm Kelly Carlstein, wishing you healthy living.